So my name is Elizabeth Zheng. I am one of the liver specialists at UCSF, and Dr. Yao and I work together. One of my interests in liver disease is hepatitis B and liver cancer. And not only is it because hepatitis B and liver cancer are very interesting diseases of the liver, but both of these diseases affect me and my family personally. So I have a personal interest in helping people with hepatitis B, diagnosing hepatitis B, diagnosing liver cancer, and preventing both of these diseases. And so I really thank you all for spending some time with us today to learn more about liver cancer and raising awareness of liver cancer, because it's one of the cancers that many people don't talk about, but it's just as important as breast cancer, colon cancer, and can be treatable. And I think that's what we would like to emphasize on our talk today.
多謝你哋嚟參加呢一個嘅我哋嘅講座嚇。咁我係姓姚嘅，我叫饒永康。You know, my name is Francis Yao。咁我喺UCSF 已經幾年啦。OK， 所以我做肝嘅醫生做咗好耐啦。咁我一路咧都係睇好多 B 型肝炎嘅人嘅病啦。咁同埋我自己嘅研究同埋興趣咧，都係喺 B 型肝炎同埋肝癌嘅方面，所以我一路幾十年我都做好多肝癌嘅研究嘅辦法。所以我哋好多謝你哋今日可以嚟參加。我哋真係覺得即係 B 型肝炎咧係好普遍，好多人都唔知，同埋咧好多人都忽略咗肝癌嘅測驗咁樣。所以希望今次咧可以等好多人又比較對呢方面有多啲警惕。So I really appreciate all of you for coming. Francis Yao, I've been at UCSF for about 25 years, and I've been practicing liver for a long time. My passion is really in hepatitis B and also in liver cancer. I've done a lot of research in these areas. So I really appreciate you coming, because the whole idea is to really heighten the awareness of liver cancer as well as hepatitis B and other liver diseases, so we can do more about it. Okay, we can help more people. Okay.
So we wanted to focus primarily on raising awareness for liver cancer. And the reason is because we wanted to do it in honor of Liver Cancer Awareness Month. So October is Liver Cancer Awareness Month. And I wanted to highlight that liver cancer is a leading cause of death worldwide. So this affects everybody across the world. This is a map of the whole world, and it's a map that shows who is being diagnosed with hepatitis B, or where hepatitis B is being diagnosed. And so the parts in the world that are in dark blue are the parts where there's higher rates of hepatitis B. And in the lighter blue, there's less hepatitis B. So we see in parts of Asia that is in dark blue. So this is where the rates of hepatitis B is highest. And in the US here, we see that we're kind of medium blue. So the rates are not particularly low, unfortunately, but not as high as in some parts in Asia. And what I would really like to show, though, is that even though liver cancer is a leading cause of death worldwide, it really impacts us here in the US.
咁咧就係你哋知道咧，就肝癌係一個好重要嘅一個毛病。咁咧每年10月咧就係肝癌嘅宣傳月 ，OK， 所以咧就剛剛好今日就係10月，所以借呢個機會同你哋講見解多一下呢個問題。點解肝癌咁重要咧？就係因為譬如我睇嗰個全球咧，就係肝癌咧係令到人死亡嘅最大原因。OK， 咁你睇下呢個 即係個地圖啦。咁啊睇下即係肝癌咧邊度係最高，邊個國家最高？越深嘅顏色咧，嗰個發生率嘅機會就越大。所以你睇下，譬如話即係深色嘅啦，就係亞洲啦、中國啦、東南亞好多好深㗎，即係佢哋嗰個見到肝癌嗰個好多。譬如話有啲地方非洲咧都好高。OK， 咁啊美國咧就算係低，但係咧有好啲人口，譬如話中國人嘅方面咧，佢哋嗰個都係好高嘅。所以你哋要知道呢樣。咁咧就所以咧有好多人，我哋喺美國嘅咧有肝癌嘅好多都係移民過嚟嘅，尤其是亞洲人咁樣。
And we are really focusing on liver cancer in the US now because liver cancer rates are increasing. So if we look at the rates of liver cancer from 1999 compared to 2001, we see that the cancer rates are going up. There's a little bit of a drop in 2020, probably because of the pandemic, so there was less reporting. But in general, the trend is that liver cancer rates are going up. If we look at across the country, again, we see, differences in each state. But here in California, we see that the liver cancer rates are highest. So again, in the dark blue is where the liver cancer rates are the highest compared to the lighter blue, like let's say, for example, in Michigan, it's much lower than where we are in California. So it's important that we know that liver cancer exists, and it's important to know how we can prevent it and diagnose it.
So 喺美國嚟講咧，雖然美國肝癌嘅發生率唔係話即係全世界最高咁樣，但係咧嗰個發生率咧而家越嚟越高，有上升嘅趨勢。OK， 咁咧就你睇下呢度咧，1999年到而家2021年咁樣咧，一路都係上嘅。淨係2020年到之後就去低咗少少，可能因為 Covid。OK， 所以嗰啲人咧唔係咁多，即係話俾人聽有邊度。所以呢個係要知道。今日我睇到美國嘅地圖咧，唔係度有肝癌嘅都係一樣。譬如話加州咧係比較高，有啲第二啲嘅州比較低。OK， 咁啊加州係最高啦。譬如話德州啊嗰啲都係唔少嘅。譬如話紐約啊嗰啲都係高嘅。所以咧就而家嗰個趨勢咧，我哋都要好注意，因為咧好似咧嗰個發生率係有上升嘅趨勢，所以我哋要多注意。
We see that the liver cancer rates differ based on sex, race, and ethnicity. So if we compare men with women, we see that liver cancer is actually more likely to affect men. And then if you compare the races and ethnicities, we see that liver cancer are more likely to be seen in Black people, in American Indian and Alaska Native, in Asian and Pacific Islander people, and also in Hispanic. So a lot of minorities are being disproportionately impacted by liver cancer. And that might be because of the different types of liver disease that certain minority groups might have, which we'll also talk about.
So 你要知道咧，就係肝癌發生率咧係由性別、種族同埋民族咧都唔同㗎嚇。咁啊，我哋要知道咧，男性有肝癌嘅機會比女性係高好多嚇。我哋睇下啲譬如話唔同嘅種族咁樣啦，佢白人比較少啲，然後咧高啲，譬如話黑人啊、印第安地啊、阿拉斯加原住民啊，我哋亞洲太平洋嗰啲咧都係比較高，譬如話西班牙裔亦都係比較高。點解咩原因咧？就係其實佢哋高嘅原因可能唔係好同嘅。譬如亞洲咧，通常就係 B 型肝炎啦、乙型肝炎啦。譬如話有啲第二啲嘅民族咧，譬如話西班牙嘅咧，可能係脂肪肝嘅問題。所以咧，佢哋嘅原因咧係有啲唔同。但係咧就係你知道，即係男嘅比較高啲，咁咧就有啲民族咧就比較高啲，白人比較低啲。我哋亞洲人係一個好大嘅問題。
But we don't want to present all of this information to scare you. It's really not the purpose of our evening. It's actually to show you that the future in liver health is very promising. So we have ways to prevent liver disease. We have ways to prevent liver cancer. And even more importantly, we have ways to diagnose liver cancer at very early stages. And once we diagnose liver cancer at very early stages, we're able to provide treatment that could potentially even cure liver cancer. So by understanding if you might have liver disease and by understanding your risk for liver cancer, we could definitely prevent anything bad from happening and potentially just treat the liver cancer if we can diagnose it early.
我成日都聽到自己中國人咧講啲古仔話俾我聽，哎呀我個朋友嗰個親戚一有肝癌咧就冇啦。Okay? 其實咧我個見解係錯嘅，我哋應該點樣諗咧？其實我哋而家醫學昌明啦，咩嘢都係病向淺中醫。Okay? 我哋應該覺得其實我又好有對將來好有希望。點解咧？因為咧肝癌可以預防，肝病可以預防，就係靠我哋自己病人醫生早啲檢查 ，OK， 定期要檢查。因為咧，如果我哋有早期咁樣發生肝癌 ，OK， 我哋 check 得到嘅話咧，嗰個生存率係好高嘅。有好多嗰啲醫療嘅方法咧，可以將嗰啲肝癌可以清咗，可以治療，可以即係 cure 咁樣治癒，所以咧好多方法係有嘅。主要咧就係你要知道測得早，要定期要檢查。如果我哋做嗰個所謂叫做即係早期咁樣去叫做篩檢 screening， 咁如果我哋 check 得到佢係早嘅話咧，就可以即係好多人咧好多年都可以生存冇問題。但係你一定要早期嘅時候發覺。
But before we talk about liver cancer and diagnosing it, let's first start off with the liver itself. So the liver is on the right part of your abdomen, so the right upper part of your right here. And it's actually a pretty big organ. On average, it's about the size of a football. Obviously, it's a little bit smaller if your body's a little bit smaller. And if you're very, very tall, the liver is bigger to accommodate for your liver. But the liver sits beneath your lungs. So you have two lungs up here, and then you have some muscle called the diaphragm here. And then right underneath it is your liver. And most people are not able to feel their liver because it's kind of tucked away underneath your rib cage.
肝臟咧係個位置咧就喺右上腹部。係一個好大嘅器官，你上面度係肺咧，咁肺同嗰個肝咧就一個叫做橫膈膜分開嘅，所以喺右邊呢度。OK， 咁肝嘅大細咧每個人都唔同嘅，譬如我個肝可能比Dr. Zheng 大少少，咁咧就每一個人都唔同嘅，所以嗰個肝咧係同你一個身形係有會即係影響嗰個大細，會因為跟住你個身形 ，OK， 所以係好呢個好唔尋常嘅一個，所以肝嘅大細唔同嗰個。
So the liver is a very important organ. It has a lot of different functions. One of the main functions includes filtering your blood and taking out the toxins. Most of the medications that you take go through the liver. So the liver metabolizes all of the medications. It also has a big role in your immune system. So a healthy liver means a healthy immune system. And it produces a lot of things. So it produces proteins that you need to clot your blood. It produces enzymes that you need to break down food, to fuel your body. And it produces bile to help digest fat in our food. So as you can see, the liver has many, many different roles.
咁咧就肝嘅功能咧係好多嘅， 肝咧係一個唔可以少嘅一個器官。Okay? 譬如話可以過藥類血液啦、排毒啦。咁我哋講係代謝藥物啦，你食啲咩藥咧？佢要將嗰啲差即係唔好嘅嘢會清除啊咁樣。咁咧就要維持健康免疫系統方面嘅發揮作用咧，又係一個好大嘅功能。咁咧肝咧會產生好多唔同嘅嘢嘅，譬如話我哋凝血需要嘅蛋白質啦，或者係將食物分解為即係佢哋燃料啦，佢哋做好多嗰啲叫做即係新陳代謝嘅功能嘅。咁另外咧，佢有膽汁係由肝分泌出嚟，咁咧佢會幫身體消化食物中嘅脂肪，所以肝嘅功能係好多。
Unfortunately, there are a lot of different things that can cause inflammation to the liver. And when you have inflammation in the liver, that can cause injury. So I've only written just a few very common causes of liver inflammation and liver injury. So there's many, many more. But I just wanted to include the most common ones. And that includes alcohol, hepatitis B, hepatitis C, fat in the liver or fatty liver, and autoimmune hepatitis. These are more common causes of inflammation in the liver, and then inflammation can cause injury to the liver.
咁我哋講咧，好多原因咧都會令到肝會有受傷或者係發炎。OK， 咁有好多嘅原因㗎，有好多種唔同嘅肝病，但係咧我主要咧就話俾你聽，有幾種係比較常見嘅。譬如話飲酒啦，譬如話乙型肝炎、B 型肝炎啦、C 型肝炎、丙型肝炎啦，或者係脂肪肝同埋咧自身免疫性肝炎，即係自己嘅白血球啊、自己嘅免疫去打自己個肝 ，OK， 咁啊等佢發炎啦。所以咧呢啲只係比較常見嘅。咁另外有好多咧都會形成肝會損傷嘅。
So why do we care if you have liver injury? Why do we think that liver injury is so bad for you? Well, it's because if you have liver injury or inflammation in your liver for a very long period of time, that can produce irreversible damage to the liver. So, for example, most people are born with a normal liver, and then you have something that causes inflammation in the liver. That could be alcohol, hepatitis B, fat in the liver. If you have these types of things that's causing inflammation and injury to your liver for a long period of time, even more than 10 years, that can cause fibrosis or scar tissue to develop in the liver. And when you have a lot of scar tissue or a lot of fibrosis in the liver, that's called cirrhosis. And we really care about cirrhosis because cirrhosis can cause or increase your risk of liver cancer. So what we would like to do is we want to prevent the development of cirrhosis. So we want to first diagnose if you have any inflammation or injury to the liver so we can prevent any of these downstream negative effects.
肝損傷有咩不良嘅後果咧？就係譬如話你發炎嘅時候咧，發炎啦一路都係咁樣拖到好耐咧，會令到嗰個肝咧有產生好多纖維化，即係疤痕。OK， 咁嗰啲疤咧，咁因為係疤咧，就係因為你嗰個發炎啦、結疤啦，咁長久嚟講咧，咁剛初嘅時候咧係正常嘅肝。一路咁樣去發炎，一路結疤嘅話咧，始終咧就會變成有肝硬化，我哋叫做 cirrhosis。OK， 有時咧要過10年，有時20年，有時咧啲人好快都唔定㗎。所以咧，當你有發炎有傷嘅時候，就一定要醫佢。
So now that brings us to liver cancer and who really is at risk of developing liver cancer. So anybody with cirrhosis has an increased risk of developing liver cancer. So cirrhosis from any cause, whether it be from alcohol, hepatitis C, hepatitis B, anybody with cirrhosis has an increased risk of developing liver cancer. and so should get liver cancer screening. Another big group of people who are at increased risk of developing liver cancer is somebody with hepatitis B. So somebody with hepatitis B plus an additional risk factor, like if you have a family history of liver cancer, if you are an Asian man older than 40 years, if you're an Asian woman older than 50 years, if you're from Africa and you have hepatitis B and you're older than 20, we recommend screening you for liver cancer. And if you have hepatitis B plus hepatitis D or hepatitis Delta, these are all people who are at increased risk of developing liver cancer and would benefit from liver cancer screening.
咁我哋講有肝癌，邊啲人會有肝癌嘅風險呢？咁啊，第一最緊要咧就係有肝硬化嘅人。Okay? 無論你係咩原因有肝硬化，譬如話飲酒啊、B 型啊、C 型，總之有肝硬化咧，嗰個危險有肝癌嘅危險性就會高咗。另外有一個，譬如話 B 型肝炎咧，就有一個特別咧，就係佢唔需要經過到肝硬化。就可能會產生有肝癌，呢個好緊要嘅。Okay? 尤其是咧，譬如話你除咗有 B 型肝炎之外咧，仲有第二啲嗰啲情況令到你要有肝癌嘅機會高咗。譬如你有嗰個叫做家族史 ，OK？ 譬如話你爸爸媽媽，尤其是爸爸媽媽兄弟姊妹 ，OK？ 如果有肝癌，你有肝癌嘅機會又高咗。譬如話你過咗一個年齡，譬如話男嘅咧過咗40歲之後機會高啲。咁啊，女嘅過咗50就機會又高啲。咁咧就如果係非洲嚟嘅咧，佢哋嗰啲有肝癌嗰個20幾歲開始高咗好多噶啦。Okay? 另外咧有啲 B 型嘅肝炎嘅人咧，好多咧都有啲唔係好多，但係有啲人會有 B 型同 D 型一齊嘅，嗰啲嘅機會咧又係高咗，有肝癌嘅機會又高咗。
So these are the people who are at increased risk of developing liver cancer. And so those are the people who really should be getting screened for liver cancer. And the reason why we very, very much promote liver cancer screening is because with screening, we can diagnose an early liver cancer, and early liver cancers are treatable. And so screening really can save your life, because if we diagnose your liver cancer at much later stages, it's much harder to treat. And the tricky thing about liver cancer is that in the very early stages, you won't have a symptom. You'll feel totally normal. And so by the time you have symptoms, it's likely already too late to give you a cure.
呢個講座我覺得係最重要嘅咧，就要勸，就係如果係有肝癌機會高嘅人咧，一定要定期叫做篩查，叫 screening。因為咧要定期做篩查咧，如果你發覺有肝癌咧，佢係早期嘅，咁你有醫得好嘅機會就高好多。有啲人咧一路都唔理佢嘅話咧，到自己發覺哎呀唔舒服啊，又唔知體重減咗啦嗰陣時咧，可能已經太遲。因為咧你要諗住咧肝癌咧，我咁樣講法咧就係話係一個即係無聲嘅殺手。OK， 有時真係完全唔知㗎。你有肝癌你都唔知道，完全冇感覺嘅，所以一定要靠定期去篩查。咁如果篩查發覺有肝癌都好啦，如果早期嘅話，我哋可以治癒。Okay? 咁啊，篩查真係可以救你一命。Okay?
How often should you get screened for liver cancer? So we recommend that you get screening for liver cancer every 6 months. So once your doctor tells you that you are at increased risk of developing liver cancer, so if you qualify for liver cancer screening, you should get screened every 6 months.
有幾耐咧就要接受肝癌篩查咧 ？OK， 呢啲係唔係淨係我哋嘅見解，係全世界人、全世界嘅嗰啲對呢方面有經驗嘅專家都係咁樣講。6個月，每6個月要檢查一次。咁啊，我有時聽到話，哎呀，呢個驗疏咧唔包喎，一年先包咁樣，嗰啲完全冇道理嘅。OK， 我會同佢哋拗嘅。OK， 唔可以1年一次，要係6個月一次。
And so every 6 months, what should you do? How do you get screened? So every 6 months, that includes an ultrasound of the liver. plus a blood test. And the blood test checks for something called AFP, or alpha fetoprotein. And that is something that the liver cancer can produce. So if your AFP levels are very high, that means that there might be a liver tumor that's producing these blood markers, making it very high in the blood. Regardless, every 6 months, you should get an ultrasound plus the blood work.
咁肝癌嗰個篩查係點樣做嘅咧？我哋嗰個傳統即係定期做係每6個月要做一個叫做超音波或係 B 超，咁咧佢就喺嗰個肝嗰度睇下你自己有冇啲咩出嚟。咁啊嗰啲係即係好簡單嘅，呢個又唔會痛又唔會傷你。另外咧就係呢個驗血咧，我哋叫做 AFP， 咁啊中文咧譯做甲胎蛋白，睇下佢嗰個水平係點樣。唔係個個都會高嘅，有啲人咧，譬如話有肝癌嗰度唔會高，但係咧高咧就等你比較醒覺一啲，即係提醒你哋一定要做嗰個超音波咁樣。
And of course, time goes by very fast. So every 6 months is actually pretty frequent to get an ultrasound and blood work. And so there are research studies to see if there's other ways to screen you for liver cancer. And so one way, which is a research study that we're conducting at UCSF, and we have our wonderful study coordinators who are here today, so thank you for coming. This is the National Liver Cancer Screening Trial, and it's looking for a different way to screen you for liver cancer. So the traditional way is an ultrasound plus blood work. But what if we can screen you for liver cancer with only blood work? If you only do blood work every 6 months, that would actually be much easier than doing an ultrasound plus blood work. So if you're interested in the study, we do have information over here in the front, and so you could contact us for more information. And if you qualify for the study, you get selected randomly. So you get selected randomly either to be in the standard group, which is ultrasound plus blood work, or you get randomly selected for the research group, which is just blood work every 6 months. And so we're hopeful that the results of this research study will really change the future in how we can screen for liver cancer, because it's much easier and better for everybody to do if we could just do it with blood work every 6 months.
咁我哋加州大學舊金山分校 UCSF 咧有一個係全國性嘅篩檢研究，咁咧研究咧係可唔可以透過淨係驗血檢查，唔做超音波去做呢個篩檢 ？OK， 如果你有興趣參加呢個咧，如果你有符合個資格嘅話咧，你可能咧就係隨機分配6個月咧，接受淨係1次嘅驗血。佢哋驗血咧係驗好幾種唔同嘅腫瘤標記 ，OK， 咁啊睇下嗰啲會唔會比即係超音波好。咁咧另外咧，如果另外一個咧就係6個月咧就係我哋傳統式嘅超音波同埋驗血咁樣，睇下邊個係比較好啲。就每6個月一係咧就係超音波驗血，另外一係淨係驗血咁樣。
So now that we've given you a lot of information about liver cancer screening and liver cancer, we just want to show you an example of one of our patients that we follow. So this is a real patient, real life experience, and patients that we frequently see on a day-to-day basis.
我就係介紹一個病例。一個睇下即係講佢嘅經驗，睇下我哋學唔學到啲點樣。
We'll just call him Mr. X. So he's 55. He has a history of chronic hepatitis B, and his hepatitis B was diagnosed many, many years ago, and he's been taking medication for hepatitis B. He thinks that he might have gotten his hepatitis B from his mother because his mother also had hepatitis B. And we know that hepatitis B is a virus that can be passed from mother to baby through blood. He was previously following with his doctors very regularly and undergoing liver cancer screening because he is an Asian man who's older than 50 years or 40 years old. So he qualified for liver cancer screening. And he was pretty good about seeing his doctors regularly, getting liver cancer screening every 6 months up until the COVID-19 pandemic in 2020. And that's when he kind of stopped seeing his doctors because who wants to be exposed to COVID-19? But he recently saw his primary care doctor, and his primary care doctor ordered liver cancer screening. So they ordered an ultrasound and they ordered blood work.
呢一個例子咧係一個55歲嘅男性，咁佢有慢性 B 型肝炎，咁好多年前咧已經診斷到佢患咗 B 型肝炎，佢一路咧都係食緊嗰個乙型肝炎嘅藥物，咁我哋懷疑佢係因為係媽媽嗰度感染咗 B 型肝炎，因為佢媽媽亦都有呢個 B 型肝炎，咁好多人咧就係喺做嬰兒嘅時候喺媽媽度感染，喺母體嗰度感染嘅。咁咧佢一路咧就因為佢已經50幾歲啦，所以咧佢一路都需要做個肝癌嘅篩檢，咁佢一路都好即係好定期咁檢查。但係好多時咧，我哋知道 Covid 嘅時候咧，好多人都好多都鬆懈咗，或者係唔想去做呢啲嘢，因為怕傳染到個 Covid， 所以咧到2020年咧，佢就冇定期咁去檢查。咁最近咧，佢見翻佢家庭醫生咧，咁個醫生咧就恢復安排咗去篩檢嘅血液檢查同埋超音波咁樣。
So Mr. X, he got his ultrasound. And his ultrasound showed something abnormal. And it actually showed a 2-centimeter tumor in his liver. This is very concerning to us. So this looks like a tumor, but we only see it on the ultrasound. And we can't diagnose liver cancer based on just an ultrasound. And in fact, we use CT scans or MRIs to diagnose liver cancer. So now the technology for CT scan and MRI is so good that we can actually detect liver cancer just by doing a CT scan or an MRI. Sometimes, and this is pretty rare, we do have to do a biopsy of the tumor to confirm what kind of tumor it is, but the majority of people can be diagnosed with just CT scan or MRI. We also use blood work to help us with the diagnosis of liver cancer. So we use the AFP level to help us diagnose liver cancer. So the higher the AFP level, the more likely somebody has liver cancer.
咁你知道呢一個病人咧，就喺嗰個超音波發覺有一個腫瘤2公分，咁點樣可以確定佢係有肝癌咧？通常第2個步驟咧就係做 CT， 即係叫做掃描。或者就 MRI 即係叫做磁共振。咁我哋而家嘅 CT 同埋磁共振咧，可以決定係咪有肝癌。好多時都唔需，大部分嘅時候都唔需要去抽樣本，即係做 biopsy 咁樣去決定。只不過有時咧個 CT 或者係 MRI 磁共振或者係嗰個掃描睇得唔清楚嘅話咧，有啲人需要做嗰個叫做咩？叫做活檢或者係抽樣本咁樣。咁另外咧，我哋都會 check 佢嗰個叫做 AFP 啦，即係叫做甲胎蛋白，因為咧個 AFP 咧咁有幫助你去即係確定佢係咪肝癌。尤其是嗰個水平越嚟越高嘅話，越高咧嗰個機會就越大。但係你要知道咧，嗰個 AFP 係有時咧好多時候有肝癌都好啦。嗰個水平都係正常嘅，所以嗰個唔夠即係唔夠準確。所以有時咧，即係2個一齊做咧就幫咗你，但係咧唔係一定嗰個 AFP 一定會高嘅。
So we followed Mr. X and we recommended that he get a MRI of the liver to really see what this liver tumor is. So this is a picture of his MRI. So this MRI shows, so if you were to cut me like this, and then so if you cut me like this, and then if you look down into my body, that's what you're seeing for the MRI. So this is the front, and this is his back. This is his right side, and this is his left side. This is his liver on the right side of his body, and this is his kidney, which is actually on the back. Do you see where his tumor is in the liver?
即係呢個 MRI 咧就係好似係呢個咁 cut，然後咧我哋喺腳嗰度睇上嚟，咁啊呢個就係佢個背，嗰個就係佢前邊，個肝咧就係右邊就喺呢度。咁啊，你見唔見到有一粒嘢啊？有見到喺呢度嘛？
This is a special MRI that uses a dye that you inject into the vein. And the dye can light up any liver cancer tumors in the liver. And so that's how we diagnose liver cancer, is that if we see that the tumor light up a certain way on the MRI, then we know that it's a liver cancer. And so you see in that part of the liver, or that round circle, it's lighting up. It's brighter than the other part of the liver. That's the tumor.
即係做 MRI 或者係 CT 咧，佢嗰個影像咧係肝癌嘅影像有特別嘅，同第二啲唔同嘅。OK， 譬如話你而家呢個即係譬如話大動脈嘅時候咧，呢個就白色啦。咁啊嗰個咧會有白色嘅。OK， 然後咧遲啲嘅話咧，佢嗰個會好似變咗黑影咁樣嘅。OK， 所以係好 dark 嘅。所以咧嗰個有好特別嘅一個影像方法 check 到佢係肝癌，同埋有第二啲可以有分別嘅。所以我哋做 CT 做 MRI 可以知道佢係咪肝癌。
So Mr. X is pretty lucky because even though he missed a few years of liver cancer screening, he eventually did get his ultrasound, and we did pick up a liver cancer, and it was small. It was only 2 centimeters. So he has a lot of different treatments available for him. But people with liver cancer, everybody is different. So there's not one specific treatment for liver cancer. There's many different treatments for liver cancer, depending on who you are and what kind or how big your liver cancer is. So there's many different variables that can determine what kind of treatment you get. So everybody is different. And so what Dr. Yao and I do is we try to figure out the best treatment that is specific to that person. So the different types of treatment for liver cancer include surgery to cut out the tumor. We can inject chemotherapy or radiation directly into the tumor. We can do a procedure in which we put heat directly into the tumor to burn it. And the last option would be liver transplant. So removing the entire liver and putting a healthier liver in.
呢個病人咧，佢算係好幸運咧，就咁耐都冇 check 噶嘛，而家 check 到咧都係好細嘅 ，OK， 只係2個公分。咁啊，我哋治療咧有好多唔同嘅方法 ，OK。咁啊，Dr. Zheng 同我咧都係成日都睇呢啲病嘅，決定有咩方法係對個病人最好。咁啊，好多方法唔係話個個都係可以，譬如話割啊，個個都可以做呢樣。每一個人個方法都唔同，所以我哋咧有一個叫做 tumor， 幫我哋自己坐喺度睇嗰個每一個病人嗰個記錄、嗰個資料、嗰個影像。然後咧就決定係我哋大家好多專家一齊決定邊一個方法係最好咁樣。咁有咩方法咧？譬如話去切除啦，我哋叫做 resection， 即係切佢啦。咁啊，另外一方法咧就係好似係化學治療啊，或者係放射治療啊。另外咧就係有啲我哋所謂即係有熱量去等於燒咗嗰個肝癌咁樣。咁啊，另外一樣咧就係肝移植係一個好好嘅方法，唔係個個都需要，但係咧肝移植其實係一個好好嘅方法。如果你係早期，如果末期咧就做唔到啦。
Because his tumor was very small, he was actually able to get a treatment called ablation. And that treatment is when we basically put heat directly into the tumor and burn it. So this is a picture of one of our doctors at UCSF putting a needle directly into the tumor to burn the tumor, and that's called ablation. And again, he was lucky enough to get this type of treatment because the tumor was small. And this type of treatment is actually curative, so it can cure his liver cancer.
咁咧，佢就決定咗就係用呢個方法咧，就係叫做消融治療腫瘤方法，英文講 ablation。你睇下佢呢度咧，呢個支針打入去呢個嗰度就燒佢咁樣。咁啊，呢個燒嘅方法咧，同割咧差唔多嘅啫。Okay? 有啲人咧割比較好，有啲人咧燒比較好，因為每一個人都唔同。咁啊，呢個方法咧其實可以治癒呢個早期嘅肝癌嘅。Okay? 咁啊，所以咧佢算係好幸運可以有呢啲方法。咁啊，尤其是佢 check 得有肝癌嘅時候，嗰個仲係早期咁樣。所以好多方法嘅，我哋醫生會幫病人處理睇下邊一種方法係最好。
And so we're still following Mr. X. He did very well after his treatment. He got CT scans of the liver every 3 months for the first year after his cancer treatment because we want to make sure nothing comes back. So usually after we treat the liver cancer, we'll get a CT scan or an MRI every 3 months for at least the first year after treatment to make sure nothing comes back. And then after we were reassured that the cancer did not come back, he went back to regular screening for liver cancer every 6 months.
佢做咗呢一個治療方法咧，個情況良好。咁咧，我哋做完之後咧，唔係話就唔使翻嚟 ，OK？ 就我哋頭第一年咧，每3個月定期幫佢檢查，用掃描睇下咧嗰個，因為有時咧你做呢方面嘅咧。嗰個肝癌仲會翻嚟嘅，所以你及早要檢查到知道。咁啊，第一年咧，我話咗俾佢做嗰個掃描咧，3個月一次啦。咁啊，遲啲咧，佢冇復發啦。咁啊，過咗1-2年嘅時候咧，就可以每6個月做。但係通常我哋做嘅方法變咗掃描，又唔係掃描，變咗係嗰個掃描，唔係話超音波 ，OK 比較清楚啲。
But just wanted to kind of take a step back and just talk about the liver again. So there's many different causes of liver inflammation, liver injury. And some very common causes include hepatitis B and hepatitis C, alcohol, and fatty liver. And so if you don't know if your liver is healthy or if there's inflammation in the liver, the next time you see your primary care doctor, that would be a good time to ask, how is my liver doing? Have we been checking my liver with blood work? Does my liver need an ultrasound? So these are good questions to ask your primary care doctor. We know that liver cancer is on the rise. So we all have to do our part in raising awareness and making sure that we're preventing liver cancer and we're diagnosing it very quickly. Because again, if we're doing screening for liver cancer, that can diagnose liver cancer early, and we can actually treat the liver cancer, and that can be life-saving. So if you have any questions, I would start with your primary care doctor first, and then, obviously we're also available. So if you need us, we are at UCSF in San Francisco here.
主要係要你記住嘅要點咧，就係第一咧就係肝損傷同埋肝硬化有好多唔同嘅原因。咁啊，呢啲常見嘅原因咧就包括譬如話乙型、B 型肝炎啊、丙型或者係 C 型肝炎啊，可以透過驗血可以知得到。咁啊，飲酒啦、酒精啦、傷肝啦、脂肪肝啦。咁啊，而家我哋知道咧嗰個肝癌嗰個有上升嘅趨勢，所以要好注意嚇。通常咧肝癌咧你冇乜感覺嘅，冇乜症狀嘅，所以唔好以為如果自己冇唔舒服，點解要檢查啊咁樣？所以呢個好緊要嘅。如果你有高嘅風險，譬如話 B 型肝炎啊、肝硬化、第二啲嘅病，咁啊你要知道定期檢查咧係好緊要嘅，嗰啲叫做篩檢。咁每個6個月咧要做一次篩檢，譬如話超音波啊、驗血咁樣，可以救咗你個命。OK， 做啲檢查你可以治癒。 你應該同你嘅家庭醫生講話，你會唔會有需要做呢方面嘅檢查啊？你有冇 B 型肝炎啊？你有冇即係會有產生肝癌嘅機會高咗？你同個家庭醫生講，咁咪去處理嘅。
Thank you all very, very much for coming. And thank you to our supporters. Thank you so much, Diana, and the Asian Health Institute. Thank you for all of your support, as well as our hepatology and transplant team, the Department of GI, and staff here who have been able to help us with this event as well.
尤其是要多謝 Diana。OK，Diana 嘅精力同埋佢嘅對呢方面嘅心血真係好少見到人，所以你唔可以退休。OK，so Diana can never retire。所以咧，我先唔需要用中文，你哋知道我哋好多嘅部門咧都幫咗我哋，所以我哋先可以有呢個講座，所以同埋可以幫你哋即係睇下有咩問題啊，幫你檢查啊咁樣。所以咧，我哋好多謝個個人嘅出力出勞動咁樣，多謝你哋，要多謝你哋翻嚟見我哋。
Thank you so much to San Francisco Hep B Free. Thanks, guys, for the Hep B screening and all of your resources and support as well. And then, of course, our laboratory, our phlebotomists who are on hand to help us draw the blood. So thank you guys so much.